How do you know when your liver is sick? I've seen thousands of patients with liver diseases, and whether you have viral hepatitis, a giant abscess in your liver, drug-induced liver damage, or a fatty liver, you will have symptoms when your liver has failed. And here are the top 5 symptoms to never ignore because they could be signs of hepatitis. Number 1, if the whites of your eyes or your skin turns yellow, then you have jaundice. Newborn babies often have jaundice because their liver is undeveloped and they need a fully matured liver in order to process bilirubin. That's why things turn yellow. Your urine will also be darker. Excessive bilirubin in the skin also will make you itch, and your stool will be pale because you won't have bile, which is what a healthy liver turns bilirubin into. If you have this condition, you really need to see a doctor right away. Number 2, if you are having unusual bleeding or bruising, such as nosebleeds, or maybe blood in your stool, or a wound that won't stop bleeding, or unusual bruising, please see your doctor. Your ability to clot is partially dependent upon a healthy liver. Your liver makes lots of proteins involved in clotting, and we can measure this with a few simple blood tests called the partial thromboplastin time and INR. Drugs such as warfarin and supplements such as vitamin C and vitamin K can affect these results. So please be sure to let your provider know what herbs and supplements you're taking. Number 3, if you have unexplained weight loss or loss of appetite, then there's something wrong and you really should see a doctor. Your liver is a vital organ that detoxifies your blood, and when it doesn't work right, toxins build up like ammonia. Yep, you heard right, ammonia like the window cleaner. And when that builds up, it reduces your appetite. It actually makes you kind of crazy, and it can make you go unconscious if you have a high enough level. It's very toxic to your brain. So please see a doctor if you have these changes. Number 4, if you notice swelling in your legs, you should see a doctor. Besides filtering your blood from toxins, your liver is crucial for your circulation. And there's 2 key reasons why. Number 1, your liver makes vital proteins such as albumin to keep fluid in your circulatory system. Otherwise, if you're low in protein, it just kind of leaches out. No matter how much protein you eat, if your liver can't make proteins, then your circulation will be compromised and you'll start third spacing your fluid and get conditions like edema or swelling in the soft tissue. The second reason why your liver is important for circulation is because literally there's train tracks through your liver to deliver blood to your lungs. And if it chokes off at your liver, if your liver gets hard or cirrhotic, if there's a blockage at that point, then your blood will just kind of pull below your liver and cause swelling in your legs. If you have swelling in your legs, you really should see a doctor. Number 5, if you have abdominal pain in the upper right-hand side of your abdomen or abdominal swelling, you need to make sure that it's not your liver causing you that pain. Now, a common problem that happens is gallbladder inflammation. The gallbladder is a sac for your liver to store the bile after it processes the bilirubin. But this sac is needed to contract. Your bile is needed to digest your fats when you eat a fatty meal. So this sac will contract to squirt out the bile to coat your food so that you can digest it. Now, when this happens and it's inflamed, that's where you're gonna get the pain. People who are at higher risk of gallbladder issues are women who are over 40, who have been pregnant, or who have been oral contraceptive pills. And lastly, people who are overweight. Or if you were overweight and you had rapid weight loss. So if you notice any discomfort after eating, you should really go see a doctor. If you have all of these symptoms, you really should go to the emergency room where you can have access to expedited lab tests, imaging scans, as well as specialists who treat the liver and can do interventional procedures for the liver. It's really crucial that you get these symptoms addressed in a timely manner. I hope this video was helpful. If you like this video, please join me on my next one. See you there.